Child psychologist Dr. Steve Tutty turned personal grief into a 30-year mission to impact the lives of children. Steve Tutty was still a young man when grief handed him his life's work. During high school and college, 2 friends took their lives and there were no warning signs, Dr. Tutty shared during a recent interview about his career. It was only afterward, in the wreckage of trying to understand the unthinkable, that the picture slowly came into focus. One friend had been hiding physical abuse for years. The other had been consumed by a pain no one around him fully understood. The losses did not just leave a mark. They left a question. This is what shifted my focus into psychology, he explained. What factors lead to such fatalistic thinking, and ultimately suicide? I thought about how best to reverse that. Should I have the chance to work with depressed youth? Those questions became a career. Dr. Steve Tutty, M.A., Ph.D., is a licensed clinical psychologist with more than 25 years of direct clinical and forensic practice, specializing in child, forensic, and neuropsychology across multiple states. He has evaluated more than 3,000 children and adolescents presenting with complex neurodevelopmental conditions including autism, ADHD, complex mood, and twice exceptional profiles, and has worked with more than 535 adults involved in personal injury litigation, often suffering from traumatic brain injuries. However, behind the credentials is a clinician who chose this work after 2 young lives were lost before anyone could intervene, and he decided that, if he could help it, it would not happen again. That sense of purpose sharpened during a master's-level internship at a sexual abuse clinic, when a supervisor pulled him aside with an observation that stopped him cold. She told me she had never observed children feel that comfortable with a clinician before, Dr. Tutty recalled. So I thought, since I have a natural ability to instill trust, especially in child victims, I must be destined to help children. That instinct has guided nearly 3 decades of clinical work rooted in a simple set of values. Identify what is strong in a child, chart a path toward their full potential, and dismantle whatever stands in the way. Steve Tutty. Success is helping others create lasting and positive change. There is a moment Dr. Steve Tutty still carries with him. Years after working with a young patient, he was stopped on a city street by a woman with tears streaming down her face. She grabbed his arms before he could say a word. Her son, she told him, was thriving in college and that without his testing and counseling in high school, she is not sure her son would have continued to live. He was doing great in life. She needed him to know. That was a very uplifting day, he shared. It is the kind of moment that does not appear in peer-reviewed journals or court records. However, for a clinician who has spent more than 2 decades navigating some of the most complex and high-stakes cases in child and forensic psychology, it is the metric that matters most. Success, at least in my career, is helping others create lasting and positive change, he said. Whether that be improving their depression, anxiety, ADHD, neurological injuries, and so on. We can help youth and young adults unlock their potential while providing injured adults the tools to help reclaim what was lost. For him, a commitment to lasting change is not just philosophical, it is built into how he works. Dr. Tutty was trained in the scientist-practitioner model, a framework that treats clinical care and rigorous research not as separate disciplines but as part of the same responsibility to the patient. That training has shaped not only how he works with clients, but also how he contributes to the broader field. In 2000, alongside renowned principal investigator Dr. Greg Simon at Center for Health Studies and other University of Washington researchers, Dr. Tutty was part of the team that helped launch what would become the telehealth movement in clinical psychology for individuals suffering from depression. This peer-reviewed research that telephone-based psychotherapy was not only feasible, but clinically effective for treating depression in primary care settings. The work was ahead of its time. A randomized controlled trial published in JAMA in 2004 would follow, along with subsequent studies in journals including the Journal of Consulting in Clinical Psychology and Behavioral Therapy, building a body of evidence that now impacts how millions of patients access mental health care. Separate research on ADHD further challenged conventional thinking, demonstrating that medication is not always the defining answer for children with attention difficulties and that targeted social skills training can be equally effective. For families navigating a system that often moves quickly toward pharmaceutical intervention, that finding carries real weight. We showed that medications are not often the panacea for treating ADHD, Dr. Tutty said. Social skills training can work just as well. Where the science meets the standard these days, Dr. Steve Tutty does not take every case, and he is direct about why. After decades working in some of the most emotionally charged and legally complex proceedings in family court, he has reached a firm conclusion about one category in particular. High-conflict divorce evaluations, he argues, place mental health professionals in difficult positions, with limited protections and responsibilities that carry enormous consequences for children and families. Best interest decisions should really shift back to the judge, he said, perhaps with mental health professionals in a consulting role only, as long as family court judges can receive the mental health training. It is the kind of position that requires both conviction and credibility to state publicly. Dr. Tutty has spent years building both. When he does take on forensic work, the standard remains consistent: understand what changed, define it clearly, and build an evidence-based path forward. In other settings, particularly personal injury litigation, that approach becomes essential. For adults navigating the aftermath of traumatic brain injury, the work goes beyond diagnosis. It involves identifying the specific neurological and psychological changes post-injury, and mapping the treatments most likely to restore function that was lost. It is meticulous, demanding work. He believes it is also the only ethical way to approach it. That same commitment to rigor shapes how he views the profession. Early on, a college professor told him during his sophomore year, bluntly, that he was underperforming and he could do better by flipping a quarter and picking answers that showed heads. It did not discourage him. It redirected him. He went on to earn straight A's his junior and senior years, a shift he still points to as evidence of what honest feedback can unlock. Treat everyone with respect and live in the moment, he said, describing the personal values that ground his work. How Dr. Steve Tutty finds balance between the science, the work, and the world around him drive. Steve Tutty does something simple most days that ends up carrying a lot of weight. He goes outside. I manage stress through nature and animals, he explained. Each day I spend time alone with dogs, cats, birds, etc., and then observe nature, clouds, the sea, the wind, and so on, at least for an hour. For someone who spends his work inside evaluation rooms, that time outside is a reset for his heart. Over the years, he has learned that you cannot ask people, especially kids and families, to slow down, be present, and think clearly if you are not practicing those same things yourself. That same mindset carries into how he travels. Tutty is less interested in observing a place from a distance and more focused on understanding it up close. He tends to stay longer, spend time with locals, and pay attention to the rhythms of daily life. A recent trip to Vietnam left a lasting impression as he immersed himself in the culture. It was super enlightening to see 16 million people coexist with respect while living in Ho Chi Minh City, Tutty shared. Tutty now spends his televideo time, every other 90 days, in such environments, and plans to explore Nepal next. His love for traveling started early. As a teenager, he was sent abroad through the Rotary Foundation, dropped into a completely unfamiliar environment in Sweden and expected to figure it out. It was uncomfortable, but it stuck with him. Years later, he came back to the same program, this time as a host, opening his home to students going through that same experience. Sitting at a table and helping someone find their footing in a new place mirrors much of what he does professionally, just in a different setting. He wants the kids and families he works with to understand what is actually there, their strengths, their abilities, the things that are working, not just the challenges in front of them. The barriers are real, but they are not the whole story. That belief is what guides him. Help identify and unlock the unique cognitive, academic, and psychological strengths of your child, he said, and chart a pathway to realize their full potential while creatively addressing core barriers. It is a clinical description, but in practice, it comes down to something more human. Meet people where they are, help them see what is possible, and give them a way forward.